Hello, my name is Leanne. I'm going to be your student nurse today. I have an order from doctor, but before that, I would like to ask your name, your date of birth, and if you have any allergies. And the patient verifies for me that she is Shirley Knight, and she was born on 10/26/1939, and she has allergies and betadine and penicillin, and I'm going to check that with her armband. And she's Shirley Knight, and her date of birth is what she said, 10/26/1939, and she's got allergies to latex, penicillin, and betadine. And I'm going to assess her perineal area and locate meatus before I start inserting catheter. And for that, I'm going to perform hand hygiene. And I assess her perineal area, and if it was previously clean, I still will clean it. Perform perineal care. I located meatus, it's right there, and perform perineal care. Okay, Miss Knight, I'm going to be right back with all my supplies and equipment. Sterile field. I inspect my package to make sure that it has not been opened and it's not expired. And I'm going to use dust cover as a trash bag situated at her feet. And I'm going to perform hand hygiene again, just in case if dust cover had any dust on it. Now I'm preparing my sterile field. First time. Make sure that I'm not touching it more than 1 inch of the border. I open away from myself. And then carefully. And then toward myself. Okay. Now I have a drape. I'm going to put this drape with a shiny side down on her bed. Within 1 inch. Situated it like so. Now I'm going to don gloves. Sterile, unsterile, I can carefully make sure that it's, I make sure that I'm not, I keep my hands above waist, above my sterile field at all times. Now I'm going to put this drape on the patient's perineal area, and it's sterile, and I make sure that my gloves or the sterile field is not touching the patient's gown or patient. Okay. Now I'm going to prepare my catheter. because the patient is allergic to penicillin betadine, I'm going to use hydrogen peroxide. And I open this and pour over cotton balls, and I dispose of that. And this one. Again, I open this and gel, dispose of that. I'm going to prepare syringe. Okay. And carefully open this part of catheter. Dispose of it and lubricate this part, the very tip of catheter, and put it inside this box, and it's sterile. Now I'm going to take my sterile supplies, situate them on the sterile field at the perineal area of the patient. I'm going to clean the perineal area. This is contaminated. This my left hand is going to be contaminated because I'm going to help to spread labia to expose meatus and clean around. And I'm cleaning the patient's left labia away from me, and dispose of it carefully. Cleaning the right labia is closest to me and dispose. And now middle, and then meatus down, disposing together. Now I'm going to insert the catheter into the meatus carefully. Okay, and when I see the urine in the catheter, okay, I see the urine in the catheter, I'm going to insert 1 more inch and carefully not to touch the labia of the patient with my sterile hand. I inserted, pushed a little bit further, 1 inch, and now I'm going to secure it with my contaminated hand, and I'm going to inflate the balloon. After I inflated the balloon, disconnect my syringe, and I pull back a little bit to make sure that it's secure. And at this point, the catheter is inserted. Now I'm going to kind of secure it to the patient's thigh and situate the bag that's collecting urine. Attach it to the bed. Make sure that it's secure and it's immovable. And I will document INO, and I will also assess the patient's reaction, and will evaluate her